Welcome to the Gannon READS program. This is an initiative that celebrates the power of words, knowledge, and community. READS is an acronym for Reading to Enhance Awareness of a Diverse Society. Tonight, we are privileged to host the Jefferson Educational Society, whose work has left an indelible mark on civic dialogue and community progress. We are gathered here to dive into the compelling pages of What the Eyes Don't See, authored by the inspiring Dr. Hanna-Attisha. In a world where the written word can transform lives, the Gannon READS program stands as a testament to our commitment to fostering a culture of learning and intellectual exploration. Through this program, we aim not only to stimulate our minds, but also to unite our community in the shared pursuit of knowledge. Tonight's gathering exemplifies the spirit of curiosity and the joy of discovery that lies at the heart of our institution. Before we begin, I would like to introduce Mr. Ben Spigen, Vice President for the Jefferson Educational Society, for a brief welcome.
Thank you, Dr. Ewing. I consider it an honor and a privilege to be here, and I'm grateful to have a brief moment to express that gratitude on behalf of the entire JES team under the leadership and direction of our president and proud Gannon alum, Dr. Furky Faradi, and additional Global Summit partners and sponsors. Thanks to Gannon President Dr. Iwanenko, to the entire Gannon University staff, especially Dr. Jeffrey Bloodworth, with whom we've had the pleasure of working with on the Global Summit over the years, Christine, Z, Paul Perrine, Jill and Jill, Jordan, Nick, Rob, Tori, and so many more. Thank you for working with us in this partnership on the Global Summit. Now, when this partnership began several years ago, just a few events were held at Gannon University's campus. This year, 11 of the 14 will be held at Gannon because of the growth of the Global Summit that we have achieved together. And this year marks the first year we are proudly partnering to include tonight's event, the Gannon READS program, as part of the summit. Now, as a proud Gannon alum myself, I have hardly any regrets about my experience as a student. One is never having taken a course with Dr. Paris Baker. If you have the opportunity, take a course with Paris Baker, because today, fortunately, I am blessed to consider him a friend and a colleague, as he's now a scholar in residence at the JES think tank. The other would be, when I was a student, I would have wished that there would have been such a thing as the Global Summit, and I would have wished that Gannon READS would have existed then. So it is heartening and inspiring to know that both exist today and to see the powerful partnership between our two institutions thanks to their shared vision for community and civic engagement and community development and growth. We all know the proverbs: if you want to go fast, go alone. If you want to go far, go together. And many hands make for a lighter lift. Now, I might be biased because I graduated from one institution and work for the other, but seeing this partnership in action tonight, and over the next coming 3 weeks makes it absolutely clear to me that this community and all of those impacted by our collective work together will go farther and reach higher thanks to our work together. So again, thank you, Dr. Iwanenko, Dr. Ewing, the entire Gannon community, the faculty, the staff, the students, the alumni, and of course to the Erie community. Let us now continue tonight's journey in the weeks ahead as we participate in intergenerational civic education to embrace our common threads and celebrate our diversity by learning and being together. Thank you.
Thank you so much, Ben. We are so excited to collaborate on tonight's event with the Jefferson Educational Society. We are also incredibly excited to have all of our students here with us this evening, as well as members of our Erie community. We are particularly honored to be joined by Dr. Hanna-Attisha, a dedicated pediatrician, a passionate advocate for public health, and the courageous author behind the 2018 book, What the Eyes Don't See. Her groundbreaking work in exposing the Flint water crisis and her advocacy for the health and well-being of children has inspired countless individuals around the world. Through her words, Dr. Hanna-Attisha has shed light on the challenges faced by communities and has ignited important conversations about social justice, environmental responsibility, and the power of community activism. Dr. Mona Hanna-Attisha is the Associate Dean for Public Health and C.S. Mott Endowed Professor of Public Health at Michigan State University, College of Human Medicine. She is the founding director of the Pediatric Public Health Initiative, an innovative partnership of Michigan State University and Hurley Children's Hospital in Flint, Michigan. Dr. Hanna-Attisha was named one of Times Magazine's 100 most influential people in the world and recognized as one of USA Today's Women of the Century for her role in uncovering the Flint water crisis and leading recovery efforts. She has testified multiple times before the United States Congress, lectured at dozens of colleges and universities, and frequently contributes to national media outlets championing the cause of children in Flint and beyond. What the Eyes Don't See was named by the New York Times as one of the 100 most notable books of the year. The book details her childhood growing up in suburban Detroit as the daughter of Iraqi immigrants and how her experiences prepared her to confront Flint's environmental crisis. As we embark on this literary journey tonight, let us be open to the transformative power of storytelling. Let us engage with the words of Dr. Mona Hanna-Attisha with open hearts and open minds, recognizing that through understanding and empathy, we can pave the way for a better, more informed future. Please join me in welcoming Dr. Mona Hanna-Attisha, and thank you so much for joining us at Gannon.
Thank you. What a warm welcome. I was told to sit in the middle. All right. Thank you, thank you. It's great to be here.
We're so grateful to have you this evening. Really appreciate your time with us and look forward to our conversation tonight. So to begin, one of my first questions really looks back and really where you came from and how that impacted your journey and the lead up to the book that you prepared. So starting with your background, if you don't mind, because it was such an important role in the book, we read about your role as an environmental activist in college, and activism and resistance definitely is a part of your family history. So can you tell us a little bit about that background and how it informed your approach to investigating and uncovering the crisis in Flint?
Awesome, thank you. I would love to answer that question. It's great to be here. Such a warm welcome. I've enjoyed my day so far here with all of you. I can feel the warmth and hospitality here at Erie, so thank you for having me. So my background, I mentioned to a group of students earlier today, like I never thought I would write a book. Like that's not what I intended to do when I went to medical school. But then again, I didn't anticipate being in the middle of one of the most emblematic environmental and public health crises of our time. So it took me a while, but I finally committed to writing a book because it was an important story to share so that we don't keep having these kinds of stories. And it was just going to be a Flint story. Like I was just going to tell you this firsthand account of being at the kind of center of this crisis and my role doing science and speaking truth to power. So that was the book I outlined. Like that was the book that I was going to share about, like, you know, being this detective, whistleblower, scientist in Flint. But if you've read the book, that's not what the book is. So the very first sentence of the book is, I am Iraqi, an immigrant, born somewhere else. As I started to write the Flint book, I realized very quickly that I could not tell you what happened in Flint without telling you who I was and where I came from. So it's also very much kind of a, how did Mona be that person that was at the right place at the right time with the right team and the right training to be able to sound the alarm in the water crisis? So I talk about my family history. You know, I'm an immigrant. Where are all the immigrants? Come on, who I know the school has, yes. Children of immigrants, grandchildren of immigrants. We are a nation of immigrants, unless you're a Native American. So I am an immigrant. My family, we came here when I was 5 years old. I was not supposed to be in this country. We were leaving badness. We were leaving the regime of Saddam Hussein, the dictatorship, oppression, and we came to America for what all immigrants come here for freedom and opportunity and democracy and a chance at an American dream. And so I was raised as an immigrant, being every day grateful to be in this country, like literally grateful. Like I had first cousins in air raids and shelters and sanctions and in endless war after war. So that was kind of part of the milieu of my childhood. And then I also, my parents kind of never shielded us from badness that was still happening back home. There's a scene that I talk about in the book. I was 10 or 11 years old, and we were trying to get any news about what was happening in Iraq, and that was before anybody knew where Iraq was. And my father showed me a picture of a baby on the ground next to his father. And it was a chemical weapons attack in Halabja, northern Iraq, a Kurdish village. Saddam Hussein woke up that day and gassed an entire village, and 5,000 people died that day. And my father showed me this picture of this dead baby on the ground with their father, and he really shouldn't. I mean, like, I had nightmares for a long time. Like, probably not a good idea to show a 10-year-old. But I was raised to know what people in power could do to vulnerable populations. I was raised knowing that I was privileged to be in this country, and that I had an obligation, a commitment to give back. And I think it was that perspective that pushed me to medicine, pushed me to environmentalism, pushed me to service, pushed me to do things like service learning trips, which you guys have here, which kind of, gave me almost this heightened antenna for injustice, so that when the Flint water crisis happened, and when I heard that there was lead in the water, because of that background, as an immigrant, as somebody who, had done leadership and service learning, I was prepared to do something. I had only one choice, and it was only to go forward. And I do credit kind of my background, and I felt that was important to include. For many reasons, in part because of the national conversation we're having about immigrants and the role and the contribution they have in our communities, but also how important it is to have experiences, really important foundational experiences early on in life that can, make an impact. I was in high school. I'll stop talking soon. I'll answer. I love talking. So I talk about this in the book, and you mentioned environmental activism. I was a high school student in our high school environmental club, and we used to recycle cans and bottles and put on plays for elementary students, and I was always Mother Earth, which was kind of weird. But there was an incinerator, a trash burning incinerator in a neighborhood next to us, and it was about to reopen, and kids in that neighborhood had higher rates of asthma, and adults had more COPD. And when folks woke up in that neighborhood, when the incinerator was operating, there was a layer of black soot on their cars and on their grass. And my high school environmental teacher, she's like, well, let's see if we can get involved. So I used to door knock and go to protests, and we worked with a community group called Clean Air Please, and we elected somebody from our group to the state legislature. And the very first thing he did when he got to the state legislature was pass a bipartisan bill that you couldn't operate an incinerator within a certain radius of a school. It was in the backyard of an elementary school. And that passed, and that was 30 years ago. And that was a foundational experience for 14-year-old me that realized the power that kids, youth can have in their community, but also how the connection between environment and health, the role of civic engagement, and how government and policymakers can right historic wrongs and truly serve their community. So my background, these early foundational experiences kind of made me this weird pediatrician with an environmental health background who was really, once again, the right person at the right time and the right team and the right training to do this work.
Wonderful. Thank you for that background. My next question, I guess, is, throughout the book and clearly in the story that you just shared, there's a theme of hope.
Yeah.
There's a theme of hope and an optimism that's clearly evident in the work that you do. And I know that when you recorded a video for our students in convocation, when we gave them each a copy of tonight's book, you talked about that this is really a story of hope, despite the crisis that occurred and the tragic nature of the lead poisoning that was happening to the community. Can you just talk a little bit about that theme and what that means to you and how that's led you through each of these challenges that you've been a part of?
Oh, I love that question. Thank you for that question. So the book is called What the Eyes Don't See, a story of crisis, resistance, and hope. So that is a big part of the story. I didn't want to just share this story of a crime, and it was a crime, committed with indifference against some of the most vulnerable people in our community, children, in our nation. That's not why I wrote this book, to share this crisis. I wrote this book to share what can happen when one of us stands up and says no on behalf of our children, and resists and creates unexpected allies and builds a team and ultimately builds a vision of hope for a community. We made the impossible possible. We went up against the most powerful forces. When I shared my research, I was attacked by the state and the federal government. People wanted me to stay silent. They wanted me to shut my mouth. But we didn't, and we kept going because this work wasn't about me, and it wasn't about my team members. It was once again something bigger than all of us. It was about our children, but ultimately about what kind of society we want to live in. Do we want to live in a place where it's okay for some kids to have lead-tainted water and some kids not? Do we want to live in a place where some kids' life expectancy is predicted by their zip code and other kids not so much? These are choices that we make, and we are not bystanders. We're not passive. We can play a role in that resistance and in that hope building. And that's the story. That's why I wrote this book, to share how, almost a playbook on how you can do it. This is how we did it, and this is how you can do it. This is how you can use science. This is how you can build a team. This is how you can be a communicator. This is how you can care and stand up alongside our communities that are facing an injustice just like our injustice.
So part of your book is also tied to really social injustice and lack of resources for certain populations within a community. And it also uses the quote, or references the quote that you use in the title of the book, "What the eyes don't see, the mind doesn't know." Can you talk just a little bit about what that means to you and how that also is something for all of us to keep in mind as we're going through our lives within our communities and what we may be missing along the way?
Yeah, so I think there was a lot of really hard parts about writing the book, like time, but research. This was on top of work. Once again, I did not want to write a book. The uncovering of the crisis was crazy. I neglected my family and my work and my trainees. But the recovery that continues to this day has also been, very time-consuming. But so it was hard, maybe harder than medical school. It was hard to write a book. I have a new respect for authors. But I think the hardest part about writing the book was choosing a title. So I had 8 pages of possible titles, and people are like, well, you have to use the word Flint, or you have to put water in there, or you have to put something. And I settled on What the Eyes Don't See, which comes from a longer phrase, the eyes don't see what the mind doesn't know. And to me, it means a lot of different things. In the very practical sense, it's about not seeing lead in water. So lead in water is clear. It's colorless. It's odorless. We don't see it. We also don't see the effects of lead poisoning. It's largely asymptomatic acutely. We see its consequences years, if not decades later. So we call it a silent pediatric epidemic when kids are exposed to lead. So we don't see lead in water, we don't see the effects of lead. But what I love about this title and this phrase and why it's so applicable here, because people closed their eyes to Flint. People in power and the state and the nation turned their head and closed their eyes to what was happening in Flint for a long time, for about a year and a half. And what I like about this title and this phrase is because it speaks to the blindness that we all have to certain people and places and problems, but the power that we have to really open our eyes and to learn more when we have the opportunity. So people's eyes were closed here. We spoke up. We were loud. We were organized. We used science. Eyes opened. You probably all remember those images on TV from Flint, the brown water coming out of people's taps. We shared stories. We pulled at heartstrings. We advocated. People saw, and they began to know, and they began to care, and we began to be able to make a difference. So that, to me, gives me hope for a lot of the people and places and problems that we continue to close our eyes to the injustices that plague so many of our kids and communities, and once again about the power that we all have to see the unseen and to make a positive difference.
Really well said. Thank you for that. So you also write about the history of Flint, Michigan, and the role that it played in the crisis there, along with some of the challenges that Flint and Michigan as a whole were experiencing at the time. Can you talk a little bit about the role that history played in developing this water crisis?
Yeah, that's a great question. I love history. So if you read the book, there's like rabbit holes of history. I was always taught as a learner that if we want to figure out how to move forward, if we want to figure out like what's going on today, we start by looking back. We literally step over history. We step over history, and too often as a nation, we do a really good job kind of closing our eyes to anything that's like dark or complicated, and we're not really good at like understanding history. But if you understand the history in Flint, you could have like predicted the water crisis. So we're going to do some audience participation, if that's okay. So where are the Michiganders in the audience? Anybody like from Michigan? Oh my God, there's not that many. There's no one person. Where are you from? Use your hand. What's that? Use your hand. Pull up your hand. Okay, you see her holding her hand up? Are you from like Traverse City or something? Tell me where you're from. Northville. Okay, Northville's over here. Okay, so you're from Michigan. Where are you from? Well, Ann Arbor. So Ann Arbor's right here. So we're the Mitten State, right? So we are the Mitten State, and we are surrounded by what? You guys have a little bit of it here. Water, the Great Lakes. And the Great Lakes are the largest source of fresh water in the world. 21% of the fresh water around the world is around Michigan. And here's Flint, kind of in the middle of the largest source of fresh water in the world, okay? So Flint's history, for half a century, we were getting our water from the Great Lakes. It was high-quality water that we bought from Detroit, pre-treated, and they just sent it up to Flint. So that was part of our history. That was important. But something happened to Flint that changed our water source. And to understand that, we have to rewind even further in history. If you guys read the book, you tell me, what was Flint famous for a long time ago, before the water crisis? Cars. And this is relevant today. Flint is the birthplace of cars, the birthplace of General Motors. And you must get this next answer. More importantly than being the birthplace of cars, what else is Flint famous for that is in the news right now? College football. We have had many amazing athletes that have come from Flint. So shortly after cars were being made, the auto industry was making a lot of money. Workers were working really hard, but they were not getting paid very much. On the days they made red cars, they were coughing up red. On the days they made blue cars, they were coughing up blue. No benefits, no protection, terrible wages. So what was born in Flint? The UAW, the unions. The UAW was born in Flint. One of my favorite pictures, which is in this book, is little kids, Flint kids, holding signs, marching alongside their fathers who were working. And they were demanding things like living wages and benefits and occupational health and safety. And this little kid has a sign that says, we demand better food and a better life. And those strikers won, and the UAW was born. And that birthed the middle class in America. The middle class in America was born because of the defiance, the resistance of auto workers in Flint who demanded a fair share of their prosperity. You could say this is happening right now. The auto workers right now, the UAW is on strike, demanding a fair share of their prosperity, demanding, we have the massive income inequality now. The rich are getting richer, corporations are making so much money, and our workers are struggling. They are not getting their fair share of prosperity. They are still demanding better food and a better life. That was born in Flint. So for a long time, the history of Flint was this place of prosperity. It was a promised land. Immigrants from all over the world came to Flint for high-paying union jobs. African Americans in the Great Migration North, fleeing the oppression of Jim Crow South, fleeing racism, fleeing discrimination, fleeing lynching, came up north to places like Chicago, Detroit, here, Pennsylvania, for opportunity, for a chance at equality. And Flint was that for a long time. But the history that followed is as important. It's a history of greed, of globalization, of automation, of white flight that left Flint, like many of our post-industrial cities, segregated and poor and unable to, with a tax base that was unable to support basic infrastructure. Our population dropped, and with that came kind of rising poverty and every disparity you can think of. I told a group earlier today that a kid in Flint, a patient that I see, there is a 15-year difference life expectancy, almost 20 years, between a kid in Flint and a kid in another part of our county. 15 years based on the environment, the history, the geography of where a child is born. And this is not unique to Flint. You can go on a CDC website, you can plug in any address, and you can see differences in life expectancy based on geography. So Flint was a bleeding city, lost its tax base, and then something crazy happened in Michigan in 2011, which is an important part of the story. Flint lost democracy. The state took over the city. We were under financial emergency management. This was an anti-democratic law. This was a power grab. And this was done against the will of people. The people of Michigan voted down emergency manager law, but it was pushed through our gerrymandered legislature. We are now ungerrymandered, but at that time we were gerrymandered. And this emergency manager law was put into place. And in Michigan, about half of our African American population was controlled by unelected financial emergency managers. So this is really weird. Like, scratch your heads. Like, this is not what America is all about. This is not what democracy is. Like, remember taxation without representation? Like, wait a minute, we elect people and we hold them accountable. And this was not happening in Michigan, and it was especially not happening in our poor minority communities. And that is when the austerity-driven decision happened to change our water source from the Great Lakes to the Flint River. So you could have almost predicted the water crisis if you understood that history of disinvestment, of policies that made it really hard, once again, for some kids to grow up to be healthy and successful based on where they live.
Thank you.
So learn history, take history classes. It's really, really important.
Excellent point.
Okay.
Can you talk a little bit, kind of coming off of that, that answer and history lesson, can you talk a little bit about how you applied public health model to frame the crisis and what needed to happen next once that really was uncovered?
Yeah, so we, uncovered this water crisis. We shared the science. The science was attacked and dismissed, but finally we persisted. The state conceded, and since then we have really been on this path to recovery. And when we were figuring out like what to do next, like I wished I had like a prescription that I could just prescribe to take away what happened. And unfortunately, that doesn't exist when it comes to something like lead, and also when it comes to something like trauma. There's not something that you could just, there's no antidote for that. So we had to figure out what to do next. How do we support especially our youngest and our most vulnerable? This was a population-wide lead and water exposure that was going on for a year and a half. But it was more than that. We had lots of people with skin issues. We had an outbreak of Legionnaire's disease because of the untreated water, and people died from the Legionnaire's disease. Some elderly folks. We also had a lot of feelings of anger and guilt and stress and betrayal, and just those emotions also we know could lead to kind of poor health outcomes. So our framing of what to do next was really kind of leaning on the science of trauma, that this was one bad thing that happened, this trauma, atop a community already rattled with a lot of adversity, a lot of what we call toxic stresses. And the more adversities you have, the harder it is to grow up to be healthy and successful. So our holistic response was, what can we do to mitigate the impact of these traumas in this holistic way to support the health and development of children? So since then, we've really kind of built this model of recovery. We've invested in things like, nutrition supports, trauma-informed care, mental health services, Medicaid expansion. We have 2 brand new early child care centers, literacy, massive expansion in early literacy, including being part of Dolly Parton's Imagination Library program, where kids are mailed books every month, which is awesome. Reach Out and Read, which is a clinic-based literacy program. So we have been able to put into place lots of awesome in Flint. And in some ways, you think about it, you're like, wait a minute, these are things like all kids need. All kids need like high quality early childhood and nutrition services and healthcare access and, and safe environments. We've been able to weave a lot of these services that we brought in with something called the Flint Registry, which is supported by the Centers for Disease Control, where folks tell us how they're doing. We then get them connected to services and follow folks over time. It's surveillance, but also with public health supports. We've been able to make over 30,000 connections through the Flint Registry to different programs. So that's a lot of the awesome that we've been able to put in place. The hard part is kind of keeping it going. And then all of our work from the very beginning in Flint hasn't been just about Flint. It has been about shining a spotlight on once again, kids and communities with very similar adversities, and how to take a prevention, child-centric approach to do what's best for them. So it's because of our advocacy, for example, that the Infrastructure Act included the replacement of lead pipes across the country. So the last time I got to testify before Congress, I shared why it's important. I shared the Flint story and why it's important to replace lead pipes. And I shared the science and the facts, but sometimes policymakers don't like science and facts. But I started my conversation with a story. And I shared, and I actually had a lead pipe in my hand. It was unfortunately a virtual testimony. You cannot bring a lead pipe to Congress. Like if you played the game Clue, that's not a good idea. But I held up a lead pipe to my camera, And I shared the story of the lead pipe. The lead pipe came from a home of a patient of mine, a kid who developed seizures and developmental disabilities because he drank that water. But I shared the story of his family. His family actually came up from Alabama in the Great Migration North, and they worked for Buick, and they stayed in Flint through its ups and downs. And I shared that, yes, this is a story of this water crisis that happened, but it's really a story of policies over time that haven't protected people equally and have made it once again hard for some folks to be successful. But that Infrastructure Act passed. We are now replacing lead pipes across the country. And so that's one example of how our work has not just been about Flint, but it's been about making a difference, way beyond our city and addressing many of the injustices that kids face.
Thank you so much. So as we continue our exploration of knowledge and social responsibility tonight, these recovery efforts, and how our students and the community can get involved, I want to take a moment to invite our esteemed academic deans to the stage to continue in our conversation and share some questions that they have from the perspectives of each of their areas, as well as from our students who are here this evening. So first I have Dr. Kimberly Kavanaugh. She is the interim dean for the Murawski College of Health Professions and Sciences. Dr. Karina Vernazza, the dean of the College of Engineering and Business, and Dr. Lori Lindley, the dean of the College of Humanities, Education, and Social Sciences. Thank you all for joining us this evening.
Yay!
So Dr. Mona, your book touches on a wide range of topics and issues that are central to our mission at Gannon, especially emphasizing faith, leadership, and inclusiveness, and social responsibility. And our academic deans, again, representing their areas of academic programming here at Gannon, play a pivotal role in shaping that education for our students and the transformative experiences as well. So I'm going to invite Dr. Kavanaugh to share a first question, and we'll see how the conversation continues.
Thank you. Thank you so much for being here. As Dr. Ewing mentioned, our students have shared a bunch of questions that we have, some that we'll talk about tonight. I'd like to start with, you speak a lot about the onboarding process for your pediatric residents and the emphasis that you place on introducing them to the Flint community. Can you talk a little bit about why that's so important to you and to their training?
Yeah, that is a wonderful question. So often, those of us in healthcare, we drive into our hospitals or our clinics, or even as academics into our universities and our classrooms and our ivory towers, and we stay in those really comfy, cozy places. And we fail to really understand and learn from the communities that we are privileged to serve in. So as a pediatrician and as a former residency director in charge of kind of the training of pediatricians, it has been really important for me to make sure that my learners, my future doctors, my future healthcare providers, understand the strengths in the communities and also the obstacles that they face. So they do a city tour, and in that city tour, they learn the history of the city. They go to the first site of the sit-down strike where those strikers were demanding wages. They also go to the more affluent part of town where those GM executives used to work, and they're like, oh my gosh, we had no idea that Flint had homes like this. And then they go through the many neighborhoods that are graffitied and blighted, and the schools that are shut down. So it's an important experience. They go on home visits to do environmental assessments for kids with asthma. They go interact with the court system. They go to schools and work with school nurses. They learn about, once again, the history of the city. They learn about big data. They learn about how the city and its children are doing at a population level. We as pediatricians have this lovely, amazing privilege of taking care of often one child at a time. And that tells us about that one child. So often we need to take a step back and see how the population of children are doing. So they get immersed in big epidemiological data, like what's the child poverty rate? Like why is it 70% in this city? Where are the grocery stores? You know, what is the third grade literacy rate? So when my new doctors come, I humble them, I congratulate them on being physicians, but I also remind them that health care only contributes about 15 to 20% to health outcomes. It is the knowledge about all of these other things and our ability to kind of work in those other spaces that arguably may have a greater role in the health outcomes of our patients. If we are able to raise the minimum wage in our community, if we are able to do things like universal health care or stronger environmental regulations, all of those things impact health more than health care.
Thank you so much.
Look at this girl boss panel. This is amazing. This is amazing. Amazing. Yes. Love it.
Thank you again for being here tonight, sharing your knowledge with our students. My question is more directly about what is the role, from your perspective, of institutions of higher education in raising awareness about environmental issues and public health crises to ensure that future generations are better equipped to address such challenges when they come?
So that's a great question. So what is the role of higher education in environmental issues and in all of these different challenges? And I think we have a tremendous role. So in my story, it was academia. It was university kind of scientists and professors that spoke truth to power. Because I had that academic freedom, we were able to be kind of a check and balance when government wasn't working. So higher education needs to empower their scientists and their faculty to be able to be public intellectuals and to be able to work in that public space and not silence them. There is, concern that's happening in several states where academics aren't able to say what they want to say and to speak up when there's an issue. So that's one role that higher education can play. I think another role, there's many more. We need to do a better job training scientists to be in that public space and to work hand in hand with community. More training in things like community-based participatory research, more training on listening and empathy and understanding and history, rather than I'm from the university, I know what's right, and we're going to do this. That doesn't work. It is about how do we work together with a community to address issues that they want addressed. Before I got involved in the water crisis, some of the activists said that they had approached another university and asked for help. And folks from that university said, I don't have any grant funds, or I have no effort to do this, I can't help you. And that for me is a crime. That is for me is a crime, and I think it speaks to some of the perverse incentives in academia. So often we push academics to publish and present and to get promoted. What if we change the incentives in academia? What if, working with a community was an incentive, or addressing a local issue, or working on something that is kind of pressing for that population? So there's a lot that academia can do. We are trusted resources in our community. Institutions like this one have been around this community for a long time. It's a go-to for answers and resources. And I think we can do more to put ourselves out there to address leading problems and be role models.
I'll ask a question that kind of gets at the other side of what you were just now talking about, which is the role of government. So a lot of what you talked about in the book had to do with your interactions with government and officials at different levels. How have your experiences changed your view of the role of government? And then maybe from a student perspective, we have students who are political science majors who are in the School of Public Service and Global Affairs. How can they impact society for the good from that side?
Oh, that is a wonderful question. I think a lot of people, when they hear the Flint story, they're like, failure of government at every level. Government sucks. We should defund government. And that's not the answer, and that's not my takeaway. There's been kind of many investigations that have come forth of like why this happened and what can be done about it. And a lot point to the impact of kind of austerity in government. Because of so many attacks on big government, a lot of the agencies at the state had lost funding and were doing more and more with less and less, and thus couldn't really be very preventative and ended up being reactive and were minimally compliant. And that's not how it should be. We need government to be preventative. We need government to be kind of robust and responsive and transparent and representative. When our new governor came, Governor Gretchen Whitmer, learning kind of lessons of Flint, the very first executive order that she put into place was a whistleblower protection order for government employees, to change those culture, to encourage more people in government to speak up when there's something that could be threatening the health and safety of the residents of that state. And also kind of investing in the agencies so that they can have the resources they need to be more proactive and preventative. Throughout this story, it also affirmed to me, like it did when I was in high school, about the power of government, what government leaders can do. I talk about Senator Stabenow and Congressman Kildee and some of our champions. When they found out, when our elected officials found out the scope of what was happening, they never stopped fighting for Flint. I mentioned to folks, I'm back in DC tomorrow meeting with some of these folks. We're continuing to work on a recovery, continuing to kind of advocate, once again, not just for Flint, for communities everywhere. And for me, that was an affirmation of what good government and good leaders can be and should be. And remember, this is also a democracy story. So good government works when there's a good democracy, a representative democracy, with with the ability to participate in democracy and have self-determination. When I started to be in the rooms where things were happening with government leaders, when the water crisis unfolded, I was part of many kind of meetings with the administration. And I think there's a scene in my book, the former governor and all the cabinet members came into my clinic. And I, as a pediatrician, am used to a lot of amazing women. I work with a lot of women, a lot of brown women, a lot of white coats. And into my office comes a lot of white men in dark suits. And it was like jaw-dropping. It was literally jaw-dropping. I'm like, where are the women in government? And where are the people of color? So government works, once again, when it is representative, when all kinds of folks are at the table, because when you have all kinds of folks, you ask lots of different questions and you come up with different solutions. And it's definitely changed since then. But these are things that we need to do to encourage, to have a good government. So folks out there, I encourage you to go into public service. My kid is going into public policy and wants to go into public service. We need more people going into these professions who care, who will listen, who look like the communities that they're representing.
The important role of science and population health and advocating for improvements in population health was really, emphasized in the book. We know that some of our students are future researchers. Do you have any advice for them, especially in an environment that's questioning science?
That is a great question. So that is another reason that I wrote this book, is to share kind of what can happen when we don't listen to science. Like, can you guys imagine being in the middle of a public health crisis and not listening to science? That was a joke. We just went through COVID. Folks who recently read this book, they're like, did you know that there was going to be a pandemic? Because it's like some of the same lessons, about disinvestment in public health and not listening to science and inequities. It's important to share that this is not a unique story, that we are, in this climate where there is a lot of kind of science denial and a lot of misinformation. And it's also important to share kind of the why. This also didn't happen overnight. This has been purposeful. The attacks on science, the disinvestment in public health, our kind of lack of regulations and protections that protect especially children. You know, special interests over time have made it very hard to put into place science-based policies that protect children. I talk a little bit about that history in my book. I talk about my favorite scientist, Alice Hamilton. She was a badass physician a century ago who she worked in Chicago at the Hull House with Jane Addams. She was caring for poor people and immigrants, and she realized, like, hey, a lot of the people I'm caring for are sick because of something they're exposed to in their jobs. People that were making hats had gone crazy because of mercury exposure. People working with lead had seizures and tremors. So she quickly became an expert in the field of occupational medicine. She's known as the mother of that field. And she was a lead expert a century ago. First woman professor at Harvard, like a really, really amazing woman. And at that time in the 1920s, General Motors wanted to put lead in what? Gasoline. Remember, now we get unleaded gasoline? There used to be lead in gasoline. And General Motors wanted to put it in cars and gasoline, and they created something called tetraethyl lead. And they said it was the only solution to this problem known as engine knocking, which is when fuel and air mixed and there's a loud noise. And they're like, we've tried lots of different things, but nothing works. The only thing that works is if we put lead to gasoline. And Alice Hamilton, a century ago, is like, you cannot do that. Lead is a poison. You will create a global public health disaster. And they called her hysterical, and they attacked her, and they were sexist, and they said lead is a gift from God. And they said, lead is a gift from God. And they said, our scientists have proven that it is safe. And so at that time, General Motors scientists made a deal with the Surgeon General. And the scientist's name was Robert Kehoe, and this is called the Kehoe paradigm. He said that if you can prove lead is bad, we will take it out of gasoline. And it's almost like this innocent until proven guilty, which is like not what we're supposed to do for poisons. And that paradigm, that practice in public health has persisted to this day. We assume poisons and chemicals and additives and PFAS and all these things that we have polluted our earth with, we have assumed they have been safe. And then scientists spend decades, generations proving things are unsafe, and it is impossible. It is impossible to regulate, and it is impossible to reverse the harm that has been done. So there is a history, and this is a playbook that has been followed time and time again with many, many chemicals. There's a great book called Merchants of Doubt, another one called The Triumph of Doubt that explains how we have gotten to this point of science denial. It's because of special interests who make profit over doubt in science, who attack scientists and attack victims and create fake journals and hire pseudoscientists to tell you that things are safe. So we should understand why we got here, but we need to understand how to get out of this. So we need to expose that history, expose those folks and those industries that have got us to this point, and then demand listening to science and demand regulations that kind of that follow the science and not have that kind of massive time lag. We also need to do a better job training scientists to speak to the general public. I purposefully wrote this book not for a science crowd or a medicine crowd. I wrote this book on purpose because I wanted everybody to understand science. There's like lead pathophysiology, and there's like statistics and p-values, but Oprah said it had the gripping intrigue of a Grisham thriller. Like, who knew? So science can be a page turner. But we have to do a better job training scientists to speak, to the regular public, and we're too often trained to speak in journals that are very difficult to decipher.
Thank you.
I'm going to go off script a little bit.
Yes, off script.
So we, obviously, this is not a U.S. problem. This is really a global problem. We have over 70 different countries represented in the population of our students today. Actually, 25% of our students today are global students. We also have a lot of our students. We have a rich global study abroad program. We have students that go to different countries. There's countries where they tell you, don't drink the water. Make sure you're drinking bottled water the whole time. And we also have a lot of service trips where they are helping in a town to get water access, building pipes, to bring water in. So really, it's really a global issue. So my question is along those lines, how can, knowing that this is a global problem, how can nations collaborate to address water safety and other environmental challenges on a larger scale? And on that note, how our students, as they travel, can bring that message forward?
That is a great question. So, even in my institution, we used to have medical students who went on mission trips, and they still do, and then the water crisis happened. They're like, wait a minute, why do I need to go to Haiti to work on water issues when there's like a water issue like right here? And then the beauty of what happened in Flint is that the developing countries came to us to advise us. They're like, this is how we do water reclamation, and this is how we filter water, and this is what you can do for your community. So it was humbling. It was awesome, and that was important to understand that we have a long way to go. Despite being the richest country in the history of the world, we have a long way to go when it comes to water access, water quality, and water affordability, and that we can actually learn from other communities. So I think that was a really important kind of lesson in the global landscape. But yeah, these are global issues, especially with climate change. One of the first impacts of climate change is going to be its impact on drinking water quality, and the ability to even obtain drinking water. There's anticipation that the Great Lakes might be this kind of climate refuge because of our access to water, and that some places will be unsustainable. So these are global conversations. We need to have these conversations. We need to be part of some of the international convenings. There's something called the International Joint Commission, which is a partnership between the U.S. and Canada about these kinds of environmental issues. Obviously, work with the United Nations and the World Health Organization. So there's lots of other organizations out there that are addressing this, and students can get involved. And those experiences are foundational for students to be part of those international trips, to go humbly, to learn, to recognize that you are a guest in these communities, and that there's so much more that you will probably gain from that experience that you will bring back.
I want to ask a question that came from a student. How has this crisis impacted your connection to Flint, both professionally and emotionally?
That's a great question. I am still there. I am still, I was in clinic this week. I am still grounded. I love Flint. I think it's surprising for a lot of folks that when they come to Flint, it kind of feels like Erie. There's this warmth, there's this pride, there's loyalty, there's history, there's graciousness. It is a really special place. Our former lieutenant governor, who had never been to Flint often, he's like, Flint's a city that's easy to fall in love with, and it is. So I think something that has changed, and it was from the beginning, but it's more so now, is how much my work is driven by Flint. So remember, we were this democracy story. People were loud and organized and saying things were wrong, but they were being dismissed and denied. There was no accountability, no representation. So part of our recovery, foundational to our recovery, has been participatory democracy and self-determination. So in my initiative that I run, I have a director of community engagement and implementation, a woman from Flint who always has a seat at the table at everything that we are doing. I have a parent partner group, a group of parents that have been advising me for 6-7 years. They're moms, dads, grandparents. They represent every ward of the city, and they tell us what we should be doing. And my favorite thing that we have is I have a group of children, Flint kids, that also tell me what I should be doing. And they're called, they named themselves the Flint Youth Justice League. And it's an amazing group of kids that are 8 to 18. And I go to these meetings and I close my mouth, which is really hard because I love talking. And they share what's important and what we should be doing. And they have become these amazing national leaders when it comes to things like environmental justice and children's health. Shortly after the Flint water crisis, there was a similar crisis in Newark, New Jersey. And our Flint kids were Zooming with kids in Newark and telling them what a part per billion was, how to sample for water, and what to advocate for. So our kids are amazing. So I think what has changed is just the everyday deliberate effort that this work is done in partnership. My newest project, which we're starting, which I've mentioned to a few folks, is something called RX Kids. We are starting in 2024, we are prescribing unconditional and universal cash allowances to all pregnant moms and all babies to eliminate poverty. So this is starting next year. This idea came from our moms. They came from our moms saying it is hard to make ends meet. It also came from our data, from the registry data, from census data. We have a 70% poverty rate. So we were, our parents and our kids are tired of shrugging their shoulders that, with these big insurmountable problems. So this idea came forth. We've been working together, and we're launching this impossible program that has never been done anywhere to eliminate infant poverty. 2 days ago, I had a lunch with pregnant moms that were all due in January. It was amazing. They're all going to be part of this program. All of these pregnant moms just sharing, what should this program look like? Where should we market? What should be the research questions after we launch it? How to share this with other moms? So once again, what's changed is the humble partnership of being part of this community and really kind of the privilege to work in this community.
You mentioned Dr. Alice Hamilton.
Yeah.
And one of our students asked a question and noted that you're kind of like a modern day Dr. Alice Hamilton, showing how one person speaking out can make a big difference. For the young folks out there, especially those who might be studying medicine or science, engineering, what's your advice? How can they stand up for what's right, especially when they may be up against some pretty big hurdles?
That is a great question. So I have a little bit of advice, and for some reason, it all starts with a P. So just bear with me here. So my first advice to young people is to find your thing, find your passion. Your passion, what is your passion? What's your why? What's your North Star? My why, my passion is kids, right? So what do you care about the most? And something that I see in young people is you guys care so much, and it's overwhelming, and it can lead to burnout. There's so many things to care about. So try to find your passion. Find your thing. So that's my first bit of advice. My next bit of advice is find your peeps. Find your people. Find your village. This work is not just me. I have an amazing village. And it's an unexpected village. It's people from different disciplines and different walks of life that all care about that same passion. You need your people. You need your peeps because this work is hard. And sometimes they need to be there to lift you up, and you need to be there to lift them up. I think so often we feel like we are shouldering the burden of a problem by ourselves. We're not. There's other people that care about the same thing that you care about. So find your passion, find your peeps. My next bit of advice for those who want to make change is persistence. You have to keep at it. And it's about making little change, changing the food in the cafeteria, or big change, changing a national policy. It requires persistence. This is a story of persistence. It's almost like I was annoyingly persistent, and I'd be like, "Hi, I haven't heard from you. I still haven't gotten the data. Oh, did I miss it? Oh, can you please share when am I going to get that data? I haven't heard back from you." Persistence, persistence, persistence. This Infrastructure Act, which just passed, which is replacing lead pipes across the country. People have been trying to do this before I was born. But there was this window of opportunity, and we were persistent, and we jumped through that window. So persistence, persistence, persistence. So find your passion, find your peeps, be persistent. My last bit of advice is be prepared. What you are doing right now is preparing you to tackle big problems. You're learning about another story where somebody tackled big problems. The amazing courses that you have here are preparing you to be a critical thinker, to be curious, to ask questions, to do science, to digest information, to be a leader. When it's part of it is in this book, but a lot of how I became who I am started in college. My first opinion, my first letter to the editor I mentioned earlier to the group was for the college newspaper. They were going to cut funding for service learning, and I got so mad because I had just done an alternative spring break trip, and I loved it. And I'm like, how can I do that? So I wrote a letter to the editor in our school paper. My last letter to the editor was in the New York Times. But doing it in college prepared me, and it was in a safe and a supportive environment where it was okay if I failed because there was folks there to help me get back up. So take advantage of the opportunities you have. Go to random lectures like this, even when it's not required. Go to, even if I don't know, I'm going to go to this talk on astronomy. You never know what might spark in those moments, and you're never, again, are going to have such an amazing time to be around so many incredible, influential, brilliant people. Probably, maybe go to grad school or be part of this Jefferson thing, which sounds amazing. Lots of learning and good stuff. But so those are my bits of advice. So find your passion, find your people, find your peeps, stay persistent, and be prepared. And you're doing all of that right now.
Yes, we have time for one more question.
One more question. This is going to be an amazing question.
This is the last one, but this is also from students.
Students
in
are
Gannon
amazing.
101.
Yes.
They say here, the book explores a variety of challenging ethical decisions. Could you elaborate on the process you used to develop these moral issues for the characters and what you hope the audience will take away from them?
How I developed the moral
issues for the characters and individuals in the book, or how you express those in the book.
Yeah, so there was a lot of kind of ethical decisions that were made in the story. There was a lot of ethical decisions also that were made about what to include in the writing of the book. And the book is by and large kind of the facts, like it's what happened. All the major characters in the book, I had them read the draft of the book to make sure, like, is this how you remember the conversation? Is this how you think this is what happened? But all of the ethical decisions that were made in this crisis were really kind of rooted in my why. People are like, oh, you were so brave, you had so much courage, like, to speak up, and did you do this because you were a doctor, because you took that oath about patience? And my answer to all that is no. Like, this is doing this work is what it means to be part of a society. It's what it means to be civically responsible. Like I said earlier, doing this there was no choice but to do this. It was a choiceless choice to be able to kind of go forward, even though I knew that there was going to be, backlash and people trying to make me silent, to silence me. And I think, that's really the most important part of the story, is that all of us, no matter who we are or what we go into or where we live, we have the power to stand up when we see injustice. And it's going to be hard, and it's going to be scary, and your heart rate's going to go up, and you're going to have a funny feeling in your stomach. But it's often when we do the right things in our lives, it's often the hardest thing to do. When we go against the grain, when we buck the status quo, when we stand up for the vulnerable among us. So I would just like to leave folks with that message. When you are reflecting on your life, when you are retired and you are reflecting on your life, it will be those moments that you did those hard things. It will be those moments when you stood up, especially for others, that you will value, that you will remember, that you will cherish, that will ultimately enable you to grow as a person and to contribute to your communities. Thank you. Thank you. Thank you.
That was such a wonderful message and a wonderful ending for our conversation this evening. I want to take a moment to thank all of our students for their participation this evening. Students, yay! Thank you for your questions and your engagement. I want to thank the academic deans for being part of this, the team that put this all together, and our team here at the Warner Theater. And then a special thank you to Dr. Mona for her words of wisdom, her story, and her message of hope.
Thank you. Thank you. Thank you.
So Dr. Mona will be available after tonight's event to sign her book. Books are available for sale from our bookstore as well in the lobby. You may be able to capture a photo with her. Please stop by to say hello, and thank you all again for being here this evening. And please, we hope you can join us as we continue the Jefferson Educational Society events this week and in the coming weeks. Thank you all. Have a wonderful evening.
Thank you.